Can you hear me?
Yes, I can.
Yes, sir.
Good evening, sir.
77
Good evening,
participants.
sir.
Your voice is very clearly.
Now you are telling me to start fellowship class. What fellowship class I will start? You all don't take any efforts. What I will do? And allow people to enter and speak. Until doubts are clear, things cannot move. Right now, sir is taking class every day 8 o'clock. And put up my Facebook profile. Minnie, 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 can you hear me?
Yes, sir. Yes.
See, to increase the number of students, what you have to do, follow, you write down, you copy my link of Facebook profile, right? Copy it, then write MK Sastri, right? And then interactive classes going on, fellowship class is free. I'm amazed in acupuncture and all, paid classes students are more than the fellowship classes. Please write down in all the groups, MK Sastri is taking the class. And give the recording to Vijay, Mr. Prakash Jain. Prakash ji, Prakash ji. Prakash Jain is there, Vinny?
Yes, sir. He's there.
Prakash ji, my voice is clear?
Yes, sir.
ऊपर बैठो बेटा, don't sit. You take this support. No, that is not good. Don't sit down. You take pillow support. Come this side and take the pillow support. Okay. See, now when we speak about the system of medicines, there are many systems of medicines. But so far Western medicine is concerned, it's concerned mainly of medicine and surgery. If you come out from there, we have homeopathy and Ayurveda or herbal medicines. But then do you think these are capable to recover patients? Some chronic autoimmune disease? I don't think so it's possible. So today you will see I've reduced obesity up to 7 inches in a patient. She was so obese. She was using double XL. Now she has come to XL. Just now I've treated a patient who was infertility. She has failed in IVF. And I just put some needles and I'm sure she will be successful in having a child in coming 4 or 5 months. I've done many such cases. More than 400 babies have come out from my own hand. So all this is not possible. Everything is possible, provided what you want to learn, that is important. आप क्या पढ़ना चाहते हैं वो इम्पोर्टेंट है. मैं तो अभी उस पेशेंट को ट्रीट करके आ रहा हूँ जिसके साइज डबल एक्सेल थी, अब वो एक्सेल हो गई. कितने दिनों में? 20 दिनों में. नीडल कहाँ मारी है हमारी? अभी एक प्रेग्नेंट लेडी है, नॉन प्रेग्नेंट लेडी है, शी वांट्स टू गेट प्रेग्नेंट. नीडल कहाँ मारी है हमारी? My voice is clear now?
Yes, sir. Yes, sir.
Yes, sir. Enough clear.
Yes, sir. Yes,
Or should I bring the mic more close?
Okay, sir. Okay, sir. No, sir. Thank you, sir.
So I give this opportunity to you to ask me as many questions as you ask. आप सवाल पूछे मैं जवाब देता हूँ. First thing is your doubts. So if you have any doubts, please ask me. This interactive session means what? Question answers. You have seen interactions now? So first all your question and answers has to be answered. Let it take 10 days, 20 days. First, whatever is in your mind, ask. Practicing with doubt will never solve your problem. आपके दिमाग में जो भी सवाल है वो पूछे.
good evening, sir. I am Subhash from Delhi.
हाँ साहब बताइए.
हमारे पास एक पेशेंट है जिनको सितंबर में स्ट्रोक हुआ था, ब्रेन स्ट्रोक. He lost his vision.
I'm not able to hear you.
He lost his vision. एक पेशेंट है, 42 years of age है, तो ब्रेन स्ट्रोक हुआ था उसको, सीपीआर पे रिवाइवल किया था उसको, और ही लॉस्ट हिज विजन. और रीजन ये है विजन लॉस का कि जो ऑप्टिक नर्व है वो
एट्रोपी,
डैमेज हुई है.
ऑप्टिक नर्व एट्रोपी बोलता है उसको.
Yeah.
We have
So how we
revived.
can revive?
See, that is what I said. Revision classes will discuss about this. First of all, we have to study what is optic nerve atrophy, how it is created. For that purpose, fellowship class was created, right? There are two parts of a disease. Can you explain me what is optical nerve atrophy? Of the
Optical
report?
nerve,
Yes, tell me.
optical nerve atrophy because of lack of oxygen. The optical nerve has got damaged.
Cortical? What is damaged?
I'm not that much of a knowledge about it.
No, the cortical? It's okay. What is wrong?
Optical,
I'll correct it. What is the problem?
yeah,
Cortical?
it's an optical. It's an
Ah.
because of this trauma happened. The oxygen supply has hampered. So optical nerve did not get enough oxygen, so it get damaged. So is it
More,
possible that we can
more,
revive?
more answers. Or more questions. See, optical nerve can be recovered. I myself had optical nerve atrophy. I have recovered it. The recovery is not a big issue. The big issue is what is your approach towards the disease.
We are just want to get the what should the modalities of the treatment.
See, do you know anything about NIBS? Do you know anything about brain stimulation? Do you know about nerve and brain connections? Do you know about
Yeah,
anything about stimulations?
we are giving, yeah, it's in a
No, I have
motor.
not given. Say one thing, I tell you. In this conversation, I have not given anything such like that.
Okay.
We are just discussing. Even class, I'll be teaching something, but not
That's
NIB.
what I am to learn from you.
See, what you want to learn? You want to learn these topics, right?
Yes.
So, go to WhatsApp or your friends group and advertise this. Oh. What is the harm in that?
Good evening, Guru. I am Manisha from Indonesia.
Oh,
Hello. How to treat patient?
हेलो सर
हाँ क्वेश्चन पूछे।
कोई पूछ रहा था बोलो
Hello, sir.
हाँ yes, was speaking.
Yeah, so I just want to ask you, as you said just now, you're coming by treating a lady infertility by putting a needle in her brain, in her skull. So can you just give me something? Like, what the physiology behind it?
See, what is your brain? Where is the image made?
Yes, sir.
Where is the real image formed?
Real image. Oh,
Because you did not study class 12. And then your syllabus called optical atrophy, which we study about what? We study about
hello, sir.
tell me.
My question is, आप अभी आपने बोला है कि आप इनफर्टिलिटी को ब्रेन पेशेंट को स्कल में निडल करके ट्रीटमेंट किए हो. So I just want to know the physiology behind it.
Good night, sir.
More questions?
Yeah. I'm very much tired, sir.
Yes, questions, please.
Hello, sir.
Yes.
You're very much tired, sir. Take some rest.
It's okay, I can continue.
Take care, sir.
I need just 5 minutes, but then also I can continue the class.
Okay,
It's
sir.
everyday routine. How many days I'll take rest?
You must sleep, sir.
Nothing. You continue. I'll reply all your answers. Hmm. So what was your question? What was your question?
Sir, my question is, as you just said, you have came by treating a woman by putting a needle on her skull for the infertility.
So see, brain is chemical and why? Then it's the same answer why I put the needle on the scalp and paralysis recovers before your half cup of tea is over.
Reason that is reason because the motor and sensory part for the movement will come from the brain, but the infertility and the pregnancy is not associated with brain also.
See, you have to study and you have to find a pathway and you can do it. I do it.
For
How did
pregnancy,
I
sir?
own 500 children? 34 years.
Yes, sir.
500. I've written a book. How to succeed IVF through acupuncture. The lady who has come to me, she will recover in just, she will have baby after 3 or 4 months. She will become pregnant. But I don't take this type of cases. I like pain, paralysis, autoimmune disease, Parkinson and all. I don't like treating gynae cases.
अब कौन सी बुक की बात कर रहे हैं सर?
मैंने 40 किताबें लिखी हैं.
कहाँ है?
वो मेरे पास है.
शेयर
मैंने
कर
इसलिए नहीं दिया क्योंकि कोई उसके लायक ही नहीं है. कोई काम ही नहीं करता आपके अलावा. मैं क्यों दूं इतनी मेहनत से लिखी हुई किताब? किस पात्रता होनी चाहिए. You must have that capability to take things from me. I have written book with day and night. I did not sleep for a whole night and then I have written that book. Spoiling
देंगे,
my health, I have written that book.
देंगे तो पात्रता आएगी ना सर.
पात्रता, पहले पात्रता साबित तो करो आप. ग्लास ही नहीं है, मैं पानी कहाँ से दूं? एक फेलोशिप क्लास में एक लाइन तो नहीं लिख सकते. एक आदमी को इनकरेज नहीं कर सकते. कहीं फेसबुक में कुछ नहीं है, कुछ नहीं कर सकते. खाली आ जाते हैं, सुन लेते हैं, बैठ लेते हैं. एक्टिविटी तो लाओ अपने अंदर. जैसे हम बोलते हैं ना पैरालिसिस में, कंफर्ट जोन में चले गए. यू ऑल आर इन कंफर्ट जोन. पहले कंफर्ट जोन से बाहर आई है. मैं पार्किंसन एक साथ 140 पेशेंट कैसे ट्रीट करता हूँ मॉर्निंग से नाइट तक, और सबके सब टर्मिनल स्टेज के हैं. कैंसर, वैंसर सब है. मरने वाले पेशेंट है पार्किंसन के. अगर एक महीना ट्रीटमेंट नहीं करो तो अगले महीने टपक जाएंगे. ही है वो पेशेंट्स को लेके बैठा हूँ. कैसे रिकवर हो रहे हैं?
कोई नहीं, रिवीजन क्लास में तो आप ट्रेन करेंगे ना सबको.
रिवीजन क्लास में काफी कुछ ट्रेन करेंगे, बट ये सब तो क्रिटिकल केस है. सीकेडी, आज किडनी भी रिकवर, किडनी में काफी कुछ रिकवर किया जा सकता है, बट उसके लायक आपको बनना पड़ेगा.
कोई नहीं सर, रिवीजन क्लास में दीजिए कुछ अच्छा,
ना रिवीजन क्लास में यू विल गेट.
और सिस्टम बनाइए इसकी कोई. ठीक है.
नहीं देखिए, रिवीजन क्लास इज नॉट, दिस इज नॉट रिवीजन क्लास. फर्स्ट ऑफ ऑल लेट मी सी हाउ मेनी आर इंटरेस्टेड. पहले ये तो पता चले फेलोशिप क्लास में हाउ मेनी आर इंटरेस्टेड एंड हाउ मेनी पीपल आर रियली गोइंग टू डू द क्लास, बिकॉज दिस क्लास इज गोइंग टू कंटिन्यू फॉर 6 months, right? First 2 months comes, then 2 months absent, then 2 months come. We don't want those students.
नहीं 6 मंथ का क्या बता रहा है, थोड़ा क्लियर करो.
फेलोशिप क्लास 6 महीने रोज चलेगी.
अच्छा, कब से?
तब से जब हमारे पास 150 स्टूडेंट, 200 स्टूडेंट होंगे. 70-80 को लेके अब ये कोई यूनिवर्सिटी के पास जाएंगे और वो आप उसको बोलोगे फेलोशिप की सर्टिफिकेट दे दो, कोई नहीं देगा. मांगेंगे 5-5 लाख रुपए. 200 होंगे तो वो $2,000, 3,000 रिंगिट, यानी 30-40 हजार रुपया में आपको यूनिवर्सिटी डिग्री मिल जाएगी. जैसे वी हैव गिवन सर्टिफिकेट्स इन फिलीपींस, राइट? My 2-year certificate was accepted by DOPT and Dr. Quadra Conto has got his license from Philippines on the basis of my certificate. My classes were examined by the government of Philippines. Everything was there and they got it. बहुत जल्दी फिलीपींस के साथ हमारा MOU हो रहा है. उसी तरह लिंकन यूनिवर्सिटी, आप किसी भी यूनिवर्सिटी के साथ जाओ तो आपको इंटरनेशनल डिग्रीज चाहिए, ताकि आप बाहर भी. नेशनल डिग्री यू ऑलरेडी हैव, यू हैव ए नेशनल लाइसेंस. नाउ यू नीड इंटरनेशनल डिग्रीज. इंटरनेशनल डिग्री का कॉस्ट मालूम है आपको? एक्यूपंक्चर का कितना है? 1 करोड़ रुपया. उस कोर्स को 32,000 में लाना है, 30,000 में लाना है.
ये फेलोशिप क्लास तो फ्री है ना आपको सबके लिए?
फ्री होने से भी क्या हुआ? यूनिवर्सिटी को फीस जमा करो, फेलोशिप की लो यूनिवर्सिटी से, अपने नाम के आगे लगा तो सकोगे यूनिवर्सिटी फेलोशिप। अभी तो इंस्टीट्यूट की है, ये इंस्टीट्यूट क्या बोलेंगे हमारे पास 200 स्टूडेंट है, अब 200 स्टूडेंट वहां जाके एग्जाम दे दो और वहां से फेलोशिप ले लो, आप हो गया ना रिकॉग्नाइज डिग्री। एडवांस डिग्री होगी, अपने नाम के साथ लिख तो सकते हैं। कल को कोई लीगल केस हुआ तो ये डिग्री तो यूनिवर्सिटी की डिग्री है।
फ्री फेलोशिप लेने के लिए कितने स्टूडेंट चाहिए सर अपने को?
हम लोग को कम से कम 150 से 200 चाहिए, ताकि हम यूनिवर्सिटी के साथ बार्गेनिंग कर सके। आज के दिन में यूनिवर्सिटी 1 लाख रुपया मांग रही है, कौन देगा 1 लाख? पढ़ा मैं रहा हूँ, सब कुछ मैं कर रहा हूँ, 20,000 का काम नहीं है। एग्जाम लो, सर्टिफिकेट दो।
अपने सेकंड वीक से 50 स्टूडेंट तो मैं ला दूंगा सर।
आप कहीं से भी लाओ, अच्छे क्वालिटी के स्टूडेंट्स लाओ, कुछ भी करो।
क्वालिटी
डोंट गिव डिग्री टू डॉन। हमारे व्हाट्सएप ग्रुप में इनकरेज करो लोगों को।
बिल्कुल सर, आई गॉट योर व्हाट्सएप ग्रुप एंड आई एम जस्ट
So
स्टार्टेड फॉलोइंग यू।
my question is that you should have an international degree as well as a national degree, यानी वन नेशनल यूनिवर्सिटी का इंटरनेशनल यूनिवर्सिटी के साथ एमओयू करवा के 2 यूनिवर्सिटी की डुअल डिग्री होनी चाहिए, ताकि हम नेशनली भी हो सके, इंटरनेशनली भी हो सके। इट विल एड टू योर क्रेडेंशियल्स। नहीं तो यहाँ बैठ के एक फेलोशिप लेके चलो एडवांस इंस्टीट्यूट ऑफ न्यूरोसाइंस रिकॉग्नाइज्ड इंस्टीट्यूट है, चलो इसका अपना एक मान्यता है, चलो इसके बाद सिटी एमआरआई सब हो जाएगा, एक रिकॉग्निशन मिलेगा इसको। बट यू कैन नॉट गेट ए यूनिवर्सिटी रिकॉग्निशन ना, मेन इज यूनिवर्सिटी रिकॉग्निशन।
अभी फेलोशिप के कितने फॉर्म आए हैं सर, कोई हिसाब है इसका?
फेलोशिप के आए हैं 100 कितने अटेंडेंस आप देख लो, मैक्सिमम इंटरनेशनल स्टूडेंट्स है, नेशनल तो है ही नहीं। एग्जाम
सर
कौन देगा?
मैं कपिल चावला हूँ, दिल्ली से बोल रहा हूँ। सर मैं तो स्टूडेंट्स को इनकरेज कर रहा था, मुझे तो ग्रुप से ही निकाल दिया गया।
नहीं चलो ठीक है, वो आपको फिर ऐड कर लेंगे। आपको इनकरेज करने का तरीका इनको समझ में नहीं आया।
सर अब यूनिवर्सिटी लेवल पे जब हम पढ़ते थे तो आपस में एक दूसरे से डिस्कस, ये भी तो हमारा डिस्कशन ही जो चल रहा है आपके
नहीं
साथ।
नहीं नहीं, आपस में जो चल रहा है, जैसा भी चल रहा है, सी एवरी क्लास इज ऑन वे ऑफ डिस्कसिंग।
जी सर।
यू कैन नॉट ब्रिंग ए इनटू जेड एंड जेड इनटू ए। तो कोई बात है, कोई कहानी से निकाल दिया, फिर ऐड कर देंगे। ऐड करना एडिशन एंड सब्सट्रैक्शन चलता रहेगा, कोई उसमें कोई बहुत बड़ी बात नहीं है।
ठीक है सर, लेकिन मैं तो प्रिविलेज समझ रहा था कि मेरा एक बहुत
नहीं,
बढ़िया, मुझे आपने
आपको
प्रिविलेज
जूम
दिया है।
क्लास से निकाल दिया गया, नहीं निकाला ना जूम में
नहीं
तो।
सर मैं तो रेगुलर अटेंड कर ही रहा हूँ,
क्या
आपके तो
जरूर
वीडियो
लेना,
1-1 बजे रात को आप लाइव करते हो, मैं वो भी देखता हूँ सर।
1-1 बजे तक तो लाइव मैंने की नहीं।
सर क्लासेस के दौरान आप कर रहे थे 1 बजे
वो तो
जो।
मेरी वो उसमें चलती है, सेमिनार में।
हेलो
हाँ जी वो।
कपिल जी मेरी बात सुनो। आप
जी
कौन
सर।
से ग्रुप में है? 1 2 3 4 4 रिहैब के हमारे ग्रुप है।
हाँ जी सर, मैं बता देता हूँ मैं कौन से। एक तो सर मैं 3 ग्रुप में था, MKS शास्त्री वाले में, और रिहैब वाला जो है मैं आपको एग्जैक्ट बता देता हूँ कौन सा नंबर का है।
नंबर, आपका नंबर चाहिए मुझे, फोन नंबर।
सर मेरा नंबर है 98।
एक मिनट मैं लिख लेता हूँ, रुको। हाँ, 98
680
680
72
72
491।
491 9868072491। ओके ठीक है, कल
जी
बात
सर,
करते हैं।
थैंक यू।
See, my purpose of this class is to bring 200 students, so that when we spoke to Lincoln University, half of the students denied degree taking from Lincoln. I was amazed. Lincoln was ready to give you 2,000 rupees degree, English degree, and you denied. See, you should add credentials to your degrees. 2,000 means how much? 30,000 rupees. Now, if you had fellowship from Malaysia, fellowship from this country, fellowship from this, why people, जितने भी orthopedic surgeon है, लिखते नहीं है fellowship from Germany, fellowship from here, fellowship from there. क्यों लिखते हैं? Because it adds to your credentials.
सर 200 स्टूडेंट करना कोई मुश्किल काम नहीं है, हम इंडिया में ही 200 स्टूडेंट करते हैं। ये कपिल जी है जैसे, और 3-4 लोग हमें मिल जाए ऐसे है, और मिलके फिर डिस्कशन करके
नहीं, आप खाली इंडिया के बारे में नहीं सोच सकते। फिलीपींस नीड टू बी अपग्रेडेड, सिंगापुर नीड टू बी अपग्रेडेड, वी हैव टू bring everyone in one zone. See, question is about not one country, we have to work globally. Nigeria also has to be brought back to one streamline. Walid Wakrim is working hard.
Aligned 70-75 students by first week or second week of April.
We just need to be active in what? WhatsApp group, that's all. Anyway, this was in technical question, but the more motive is what? Motive is to get you an international MSc degree. We have already done 2 years fellowship. We have 2 years certificate. Now, can't we convert this into MSc? That is my struggle. So in Lincoln University, Malaysia and all, we can do it. But how many students we had? Only 40 or 50 or 60 or 70. Out of which 30 disagreed. How 50 students? Now they are charging so high fees. Who will go? And in reality, if you go in any international university, आप कोई भी बाहर की यूनिवर्सिटी में जाओ, इंडियन करेंसी से वो 17 गुना ज्यादा है। उनकी फीस 30,000 है, तो हमारे हिसाब से 17 गुना ज्यादा कर लो, तो कितना हो गया? 30,000 इंटू 17 कितना हुआ? 51,000। वो तो एक सेमेस्टर की, एक दूसरे सेमेस्टर की 1 लाख। अब तो ये तो समझना होगा आपको कि क्लास 5-6 की फीस जा रही है 1 लाख 2 लाख रुपए। आप तो एमएससी की बात कर रहे हो। बट जब आपके पास वो होता है, क्या बोलते हैं, ग्रुप होते, ग्रुप मतलब क्वालिफाइड पीपल विच यूजीसी हैज रिकॉग्नाइज्ड टू हैव ए डिग्री, एटलीस्ट एडवांस डिग्री, एडवांस ट्रेनिंग सर्टिफिकेट, तो ये इट एड्स टू क्रेडेंशियल्स। कल को कोई लीगल केस हो जाए, कोई कानूनी पेच लग जाए, कुछ हो जाए, तो ये डिग्री आपकी काम आएगी उस दिन। Suppose we are giving acupuncture to a person. Let us examine. You are giving one acupuncture, electroacupuncture to a patient, and he has a cardiac arrest. Cardiac arrest can happen any moment, any time, any person to any place, right? And his death on the table. We have seen a patient has come to with as an attendant in my room, and after 1 minute, the patient died. All the public was about to fight with me. I said, what happened? They said that I said something because of which he had a cardiac arrest. I said, I will tell you, all of you are donkeys. Let me see how many people have a cardiac arrest. Give me a word by which people can have a cardiac arrest. His wife has a simple spondylitis. I said, just do some physiotherapy and she will recover. With this word, create a heart attack. But I was a credential doctor, physician. Board called me, I just answered them. Police came for inquiry, I answered them. See, one thing I tell you, the biggest problem right now is the medical legal litigation. कहीं भी मेडिको लीगल लिटिगेशन में फंस गए। इवन आजकल तो कागज में प्रिस्क्रिप्शन में भी लिखा हुआ है, नॉट फॉर लीगल पर्पस। गो क्लिनिकली। हमारा रिपोर्ट ये है, गो क्लिनिकली। सो 1 करोड़ रुपए आपको सेशन कोर्ट में जमा होता है, 1 करोड़, अगर एक गलती करते हो तो। ऊपर से सर्टिफिकेट नहीं है तो आप क्वैक हो जाओगे। ये जितने BEM आ रहे हैं, ये कोई यूनिवर्सिटी से रिकॉग्नाइज्ड है, बताइए आप। मैंने तो इंस्टीट्यूट कैन गिव यू ट्रेनिंग, राइट? सो आई एम करेक्ट। Whether it is a qualified degree, yes. How many professors are there? More than 7 to 8. So is it a qualified? Yes, we have qualified the norms of an institute. Now, recognition purpose is going on. Once the recognition is done, you got a certificate at the end of the year, but classes did not stop. Because we did not charge any money. बात समझे ना? मेन इज यूनिवर्सिटी रिकॉग्निशन. Your degree should be university recognized. Hello. Yes. हाँ? आप एक काम कीजिए, ग्रुप में लिखिए, मैं क्लास ले रहा हूँ. आप ग्रुप में लिखिए ना, मुझे फोन करने से क्या होगा, मैं तो कोऑर्डिनेटर नहीं हूँ. आप ग्रुप में लिखिए कि आपका नंबर डिलीट हो गया, 3 ग्रुप में तो हैं आप, लिखिए वहां, दे विल सी दैट. चलिए, जो भी आप टेक्निकल बात कीजिए. Optical atrophy can be many way recovered because I have recovered my own optical atrophy. It is not which the eye sees, it is the brain which sees. Brain has the capacity to expand and to recover. This is what a hypothesis goes on. And on the same basis, I have treated large number of patients at the terminal stage of Parkinson, bedridden stage of Parkinson's. They are recovering. Neurosurgeon is saying, one who visited here, that without your help, neurosurgery is not possible. तो वो क्वालिटी तो लानी होगी ना अंदर, कि your degree does not become a questionable degree. It should be a valid degree from a valid university with what? Convocation. और खर्चा कितना आना चाहिए? जो यूनिवर्सिटी का खर्चा 15-20 हजार रुपये बस. कितना 200 आदमी होंगे तो 20 हजार रुपये में कितना होगा? उसको तो उसकी कमाई हो गई, हमारा अपना काम हो गया. और वही कोर्स अगर आप यूनिवर्सिटी में करने जाओ तो भैया आप जमा करो 10-20 लाख रुपए जमा करो, तब जाके एमएससी मेडिकल एक्यूपंक्चर मिलेगा. और बाहर जाओ तो 1.5 करोड़. देख लो खोल के फीसेस कितनी चल रही है इंटरनेशनली. 1.5 crore rupees you have to pay in Indian currency to take a degree. In US, that is the problem now. People are paying very high amount. Anyway, leave it. Ask more technical questions. My only thing is that you have done DNYS. It is unrecognized. Now at least you have some time to make it, convert this degree into BSc acupuncture, MSc acupuncture from a university, or diploma in acupuncture in university. But if you write diploma, you become an assistant acupuncturist. But if you write BSc, you become a competent acupuncturist. Why do we record this? Please do not delete all this. Keep it as a record because we have to submit it in the university. All the classes will be submitted in the university so that it becomes authenticity. Let the Vice Chancellor see how we have taken classes, how practicals were done. Then go and give your class in as per UGC norms, 50% of the classes can be taken online, 40% practical, and 10% what? Viva and exam. You have to come and give exam and your degree is recognized. Exam हम पास करवा ही सकते हैं आपको. We'll train you for that. Knowledge is important, but degree is important. नहीं तो कभी कोई मेडिकल लिटिगेशन में फंस जाएंगे, बस झोला छाप डॉक्टर कहलाएंगे. खुद तो बदनाम होंगे, सारी बिरादरी बदनाम होगी. इसलिए डिग्री इज इंपॉर्टेंट. अब आयुष ने मान्यता दे दी है. नाउ यू कैन क्रिएट बीएससी डिग्री इन एक्यूपंक्चर, यू कैन क्रिएट एमएससी डिग्री, and then you can create all these things. I've already spoken to Devi Vishwakarma University. बस हमें नंबर ऑफ स्टूडेंट्स चाहिए, आपका यूनिवर्सिटी में एडमिशन हो जाएगा. जो +2 है वो बीएससी में चले जाए, जो बीपीटी है वो एमएससी में चले जाए. मंडे ट्यूसडे वेडनेसडे बीएससी की क्लास हो जाएगी, वेडनेसडे थर्सडे फ्राइडे एमएससी हो जाएगा, आप लोग दोनों अटेंड करो। अटेंड करने में क्या प्रॉब्लम है? Ask questions. See, my only effort is that you get a recognized degree. That's all. Internationally recognized degree. So that it adds to your credentials. यानी आपकी, आप एक सर्टिफाइड आदमी हैं, मेरा काम है वो साबित करना. Why do I have taken 8 people, 9 people with me, 10 people with me in my group? All qualified physicians. Radiologist is coming shortly. Why am I creating CT, MRI, everything? कि आपकी मेडिकल एक्यूपंक्चर की डिग्री रिकॉग्नाइज होता है. जिसने बीपीटी किया वो एमएससी मेडिकल एक्यूपंक्चर लिख सके. वो एमएससी मेडिकल एक्यूपंक्चर इज a recognized degree from a University of India. Where did you take your training? In this center. What was the infrastructure? This was the infrastructure. तो इसको बोलते हैं टीचिंग हॉस्पिटल. Our purpose is to create a teaching hospital for you. समझे आप? ऐसे हवा में डिग्री लेके दीवार में चिपका देने से डिग्री थोड़ी ना हो जाती है. 4.5 5.5 साल मेहनत करते हैं तब जाके कहीं बीपीटी मिलता है. चाइना में अगर आप देखो तो एक्यूपंक्चर डिग्री के लिए 5 साल लगता है, 5.5 साल. उतना ही जितना एमबीबीएस के लिए लगता है. बीएनवाईएस में 6 साल, 5.5 साल लगता है. तब जाके बीएनवाईएस लिख सकते हैं और डॉक्टर लिख सकते हैं नाम के आगे. आप लोग तो 2 महीने में डॉक्टर बनना चाहते हैं. ऐसे नहीं होता. प्रॉपर वे से चाहिए, तरीके से चाहिए. You will be recognized. And we are spending how much time? 1 hour, 2 hours, that's all. उसमें बहुत कुछ हो जाएगा. हम करवाएंगे ना आपको. फिलहाल तो कोई पैसे मांग नहीं रहा. No one is asking any money from you. Most important is the money which we have to deposit to the university. To deposit money, we have to find what? Number of students who are going to MSc, who are going to BSc, or those who are going to PhD. We have PhD guides for you. We have MSc guides for you. We have BSc level also. But university charges are very high. Those charges को कम करने के लिए we have to create a group. That's all. Anyway, ask questions.
Hello, sir.
Yes, tell me.
Sir, just met one case. He's saying he's a drug addicted. Can the drug addiction can be treated with the acupuncture or the drainage?
See,
Or like,
one thing I tell you, drug addiction should be very clearly treated by the law of India. You have a proper license for drug de-addiction. If any legal complaint goes against you, you will be in a deep trouble. De-addiction centers are there. These people, they may do any trouble. They are trouble creators, right? No doubt. Your question is whether it can help. Yes, it can help as one of the part. But other part is medications are required. Sometimes even morphine is required. Sometimes other medications are required because they people become very violent. So what is the nature of your addiction? We do not know. But the de-addiction centers where we used to work, it was very horrible to treat the patient. They are otherwise okay, but when they get a panic attack, you have to give metazolam. Even in this hospital, we had to give certain sedatives to the patients. So, de-addiction is a process which has to be treated properly with proper documentation. वही तो मैंने बोला, are you qualified to treat a de-addiction patient? Do you have a degree for that? Do you have a certification for that?
very true, sir, because the patient has been into the de-addiction center almost from 7 months. Zero improvement, sir.
Whether
the
it give to improvement or not, legally are you certified to treat the addicted patient?
no, sir.
Then
But still feel very pity when parents of the
then go
patient
for
very
NADA protocol. Go for NADA protocol, very easy. Put 5 needles in the ears. It has helped so many people. Better go for that. See, first of all, you
Thank-
must have an experience. First of all, what I say, you must have an experience. Why I say that when you treat a patient on the first day, to the third day, fourth day, fifth day, you are reversing a disease. There will be many symptoms coming, which you will see that the patient has deteriorated, not improved, deteriorated.
right, sir.
Then, so you must come across all the symptoms. You must know what will happen to the patient next day, thereafter day, and how will you encounter that problem. For example, why am I working with Mohan Singh? Why am I working with Avinash? Every day we are encountering one problem is UTI infection. UTI infection is such an infection which becomes sepsis and can kill a person. Every third day we see people are suffering from fever. Why? Because they feel that they cannot go to urine, so they don't drink water. I was amazed to see one person was drinking only 400 ml of water per day.
Good evening, sir.
Hmm.
Sir, can I ask you one question that can a mentally retarded patient get any help from acupuncture?
See, I have treated so many CP children. CP, autism, I can say. Mentally retarded never came to me.
Sir, your voice is very low, sir. I can't hear.
Mentally retarded never came to me. I have treated CP children successfully. You can see I have recovered one CP child in 10 minutes, means in 10 sessions, where I used to insert the needle. And today the child is walking independent with mild support. He came with great for spasticity. Now there is no spasticity. You can go to my Facebook. I'll upload that video and you can see that how beautifully within few days
Yes.
CP children can recover. That I can assure. A
Okay.
forceps baby, whose skull was like this, his skull has grown.
Acha.
That much we can assure you what we have done. Mentally retarded, we have not worked because people did not come.
Okay, sir. Thank you, sir.
More questions?
Sir, good evening, sir. This is Johnson from India.
Good evening, very good evening, Sastri.
Sir, you are using MRI, CT scan, and SIAM for post to check the effect of the needling
No, we
technique.
are planning. That is why we are installing.
Yes, sir. Yeah, in your planning, sir, those are like those modalities are to check the physical structure, isn't it, sir?
No,
Are
see,
you?
one minute. There are 5 things which we have to check. Clinically, patient has improved, right?
Yes, sir. Yes, sir.
Then he has to improve by the nerve conduction.
Yes, sir. That's true,
NCV,
sir.
EMG, NCV test has to prove that neuropathy or certain things do not cease to exist, right?
Yes, sir. Yes, sir. Yes, sir.
On the other side, if we are able to prove with the help of MRI that the
Yes,
lesions
sir.
have reduced
Yes, sir.
in 40 people, right?
Okay.
It has become a document.
Yes, sir. That's true, sir. Sir,
Document means whatever we do,
yes,
our
sir.
problem in India is that we are not documenting the work.
Yes, that's true.
Everywhere you see some excellent work is going on.
Yes, sir. That's true, sir.
For example, you will see if you were yesterday, a patient came cryingly to me. From last 6 years, he has visited more than 30 orthopedic surgeons. They could not
Yes, sir.
reduce our coccyx pain. Why? They
Oh,
always used to give painkiller. I
that's
inserted just normal saline in a proper way. Our pain has not come up to 3 days and now she is 90% recovered.
that's true, sir.
You imagine.
Yes.
A normal saline can recover coccydynia.
Yes, sir.
Then what else we need?
That's true, sir. Sir, now like, sir, are you expecting some structural changes in the MRI when you do an MRI in this case?
See, I cannot say this as of now.
Yes.
Physically, I can say.
Yes, sir.
Clinically, that is why I'm buying MRI of 4 crore rupees with bank
Yes.
loan. Why am
That's
I
true, sir.
investing 10 crore, 7, 8 crore rupees the help of the bank?
Mhm.
Only to prove these things are correct.
Yes,
Where did you
that's true.
prove? Which documents are proving these documents are correct?
That is true, sir. That is true.
Tomorrow or day after tomorrow, if there is a medical litigation case, where is the evidence that you have done this?
Yeah. That's
Allopathy has evidence. They have published large number of papers. They have evidence of research. Where is your
Yes, sir.
evidence of research?
That is true, sir.
Now we
I
have
think we
started
need to do a lot.
free. Now you are giving, in Mumbai, you are giving 2 lakh rupees stem cells. We are giving in less than 4,000 rupees. We are taking it 5,000 rupees. We make it less than in a package,
Yes.
right?
Yes, sir.
One injection, they take 1 lakh. We take less than 4,000 rupees here, 5,000 rupees. But we go with a cycle of treatment. In this, everything is covered.
That's right. Sir, what is the role of EEG, sir? Will
See,
EEG be beneficial?
EEG is required to understand the waves of the brain, alpha, beta, and gamma waves.
Yes.
So from these waves, we can come to understand the activity of the brain.
Yes,
Whether
sir.
the patient is in seizure period, what kind of seizure it is. Treatment is same, but it is for diagnosis purpose. So after you have treated the patient,
Yes, sir.
what is the EEG level? Does the EEG changes immediately? Or after 1 month of treatment, does the EEG changes? Where are the documents?
Yes.
We all are working in air. And I tell you, one day, if any critical case happens anywhere in India, acupuncture will be banned. It will have tough rules. Today, if we don't create documents, why am I creating all these infrastructure documents? So that tomorrow, if you have a court case, this document can be presented in the court to prove that this study was made and this has happened.
That is true.
Why I have created 250,000 videos? So that this many people were treated with this type of treatment and nothing has happened to these people. And it has been internationally seen. So it becomes evidence.
Yes, that's true.
Patient can die because of any other reason. Why acupuncture has to be blamed? Why you have to
Yes.
be blamed? Why you have to go to jail? See, same problem is with MBBS doctor. You are not the one. MBBS doctor also have the same problem. What you are having. MD, DM, everyone has the same problem. I've seen MCH license has been cancelled. He fought up to Supreme Court and got his license. But that much resources we should have. So instead of doing that, why don't we create one valid degree for you and go in a proper way?
Yes. Sir, are you currently doing any randomized control trials or any other?
A randomized control trial we are doing on SIAM basis. We have
Okay, sir.
treated patients with caudal block and acupuncture needle.
Okay.
Right? Caudal block is given by anesthetist and acupuncture needles are given by me. We found dry needle stimulation gives immediate relief in 30 seconds, whereas caudal blocks gives relief in 30 to 40 minutes by 50%. Dry needle based stimulation gives relief within 30 seconds.
Okay.
Question of sustenance is that in both the groups it has been seen the recovery is more in dry needle than in caudal block.
Okay, sir. Okay, sir. Thank you for answering all the questions, sir. Right.
Thank you so much.
Thank you, sir.
Always thank you. Ask question. Instead of asking question, you thank you me. Thank you means what? Go out of the classroom, sir.
Hi, Ji.
हाँ जी, कहो जी.
Yeah. You seems to have a lot of equipment. Huh?
Om Shanti.
Are they in a special insulated room?
See, I have taken 44 room center. I have admitted patients. On daily patients, the records, vitals, blood parameters are checked, right? Now we have to check their EEG, EMG, NCV, right?
So are your room insulated?
Yes. We are going to make totally I'm making a OT room. It has to be totally this one. And then CT scan room has to be insulated totally.
Yeah,
Those
so
are
you
norms.
are
That's why
also wearing
we have to go
the
with the atomic norms.
yeah,
If
you're
there is
wearing the
small leak,
leather,
also my license.
leather garment. Huh?
We have to go by the norms.
Yeah.
It is what we are taking. See, how many months did I come to this building? Less than 1 month.
Yeah, well done.
In 1 month, we have purchased 3 OT tables.
Mm. Very good.
Established the center in just less than 1 month.
Mm.
In previous building, we were not allowed, but in new building, we have done everything in 1 month. We are buying neuromicro surgical microscope. Tomorrow, if the neurosurgeon speaks something, I must be competent enough to defend our topic.
So the MRI already installed?
No. MRI and all, the process have started. Because
Yeah.
MRI consists of 4 crore Indian currency.
Yes.
So we have to buy with the help of the bank loan, right?
Right. But I mean the premiums.
Currently, we have installed Siam. Our second installation will be of, we have already applied for PNDT license, which means postnatal detection test, PNDT. In India, individually you cannot do ultrasound, you have to have PNDT license.
So you have that license, right?
No, we have already applied. Shortly we'll have, and we can show you by ultrasound how you see an injection, where it is going. So you're confident without seeing ultrasound. I have Siam. I have shown you the location, position, and everything in Siam in a live procedure, right? आपने उस प्रोसीजर को लाइव देखा सियाम के अंदर. सियाम एक यूनिट है जो लाइव एक्सरे है. उसके बाद after you have seen the procedure, you have seen how deep the needle goes and you stimulate and you see the results, right? Same way you do here and see the results. And then without Siam, when you go from here, you don't need to buy Siam or any other equipment because you are experienced enough to do it without this. My work is to enhance your experience. आपके जो अनुभव है उसको इतना enhance कर देना है कि आपको इन चीजों की जरूरत नहीं पड़े. आपका फिंगर में मेजरमेंट या आपकी आंख का मेजरमेंट से आपको पता चल जाएगा कॉर्डल एरिया कौन सा है. कॉर्डल ब्लॉक दो, पेशेंट 2 मिनट में ठीक. Earlier I have to give double block, triple block, not block, what you call saline injection. What did you know about saline injection? Can saline injection recover pain? Did you ever study about that? Normal saline.
How come the orthopedic surgeon does not know? Huh?
Yeah.
They don't.
Orthopedic knows only painkillers.
Yeah, why don't they try the saline?
The problem is same, Roni, with here and there. We people never study research papers. We only study what?
They are taught by the pharmaceutical salesman.
Yes, you are right. We are just the agent of the pharma company.
Thank you so much, sir. Thank you, sir. Good night, sir. Thank you, sir. Good night, sir. आज मेरे पास 4 दोस्त आए हुए हमारे दिल्ली के. चारों दोस्त के साथ समय बिताना है आज मुझे. Okay.
What is our problem? Our problem is we could not create medical evidence for all these things. Once you get medical evidence, the world is yours. Let a neurologist see that neuropathy can be cured by this method. You show him 40 case studies. These are the NCV studies. In months, within 10 minutes, the neurologist will see the document and he will be convinced. Finished. He will refer you more than 100 patients. But there was no one to create documentation up to now. The whole world. So it is called traditional Chinese medicine. I don't want to use the word traditional. Traditional pulse, ooh, I don't want. I want modern diagnostics with modern system and instant results on the table. With scientific evidence. That by this procedure pain reduces, by this procedure nerves can be recovered. यानी इस प्रोसीजर से पेन कम होता है, इस प्रोसीजर से रिकवरी आती है. Degree, name and knowledge. 3 things are required. Valid degree, because tomorrow we do not know what is the law. कहीं ऐसा नहीं हो कि आपने डिग्री ले, फेलोशिप ले ली, वो ले ली. Fellowship is a training course. It's appropriately trained. As per 2003 notification in India, you are valid. But then something should be done for Philippines also. So that is why we are creating, हम लोग 200 बेड का teaching hospital बना रहे हैं. Why am I buying all these things? That tomorrow we don't need to worry about buying off all these equipments. We have already purchased. Just shift to 200 bedded hospital. We need a teaching hospital associated to university. There you come, train yourself, take degree and put in your wall, but it's a valid degree. You can write in your visiting card that you have done your degree from Malaysia, India and Canada. Who knows that these 3 universities MOU? Government is encouraging. I know the ambassadors of many countries. We can do. Just we need to talk to them. Many ambassadors are my friends. Once we talk to them, things will be done. IFS officers. More questions, please. More questions, please. Ask questions. 100 people.
No question. ओम शांति.
शांति बोलने से शांति नहीं.
कोई क्वेश्चन नहीं है.
9:10 ही हुआ है. 1 मिनट हो जाएगी. सवाल तो पूछने दो इनको. Because people always blame me, I don't answer questions. I said, let 15-20 days, I will answer your question answers. Teaching is not important. Clearing of your doubts are important. Why you have to study? Why we need group of people to study? Because we have to create quality physicians. Physicians तो पूरे देश में 5 करोड़, मेरे हिसाब से देश में 5 करोड़ physicians होंगे. We have more than 5 crore physicians in our own country, 5 billion physicians from all the fields. But how many are capable? I'm staying in the hub of the medical city of India. I see they have come to all the best hospital and no results. Then they come to me and I revive them. I counsel a new patient in 2 minutes. What is your patient? Go to room number 202, 204, 208. Similar type of patient. Go and talk to them. How much they have improved. They come and they say, Sir, we are very positive. We are very encouraged. Okay, come in for your treatment.
Hello.
I'm hearing you. Please tell me.
Good evening, sir.
Hmm.
Sir, in PID patients, उनका जो ये डिस्क प्रोलैप्स्ड हो जाता है, तो जो पेन रेफर होता है टिंगलिंग नमनेस के साथ में, या फिर लोकल पेन भी होता है, तो बाय एक्यूपंक्चर वी जस्ट मैनेज पेन.
One thing I tell you. First of all, take out this word acupuncture. Acupuncture cannot manage this type of disease, which has been very clearly written. Even in China, the professors of Chinese university, they speak on the same word while taking the class. Those patients are referred for what? Neurosurgery. किंतु अगर आप जब नर्व को स्टिमुलेट करते हैं प्रॉपरली, अंदर सियाम गाइडेंस सबको देखकर आप सीख लिया इस प्रोसीजर को, तब क्या होता है? डेज बाहर निकली हुई होने तो मुझे 12 स्लिप डिस्क के क्या हो गया? मैं 22 घंटे काम करता हूँ, क्या हो गया मुझे बताओ? मेरे को तो माइलोपैथी है, मेरे हाथ को देखो, कोई सिवरिंग है क्या? देखो 160 प्रोसीजर करने के बाद क्या होता है? इंजेक्शन दबा तो 160 बार 200 बार क्या होता? उंगली का कचुमर निकल जाता। कुछ हुआ मुझे? आई वर्क 22 आवर्स ए डे, क्या हो गया? बट पोजिशन इज टू बी सेम, लाइफस्टाइल इज टू बी करेक्टेड। दिस प्रॉब्लम्स कोई बहुत बड़ी बात नहीं है, छोटी सी बात है, ट्रीटमेंट आना चाहिए। और एक्यूपंक्चर टेक्स ईयर वन, इवन इन द बुक्स इट इज रिटन इट विल टेक 6 months। हम 5 दिन 2 दिन में पेन कम कर देते, एक मिनट में पेन कम कर देते हो। बोलो, पेशेंट आया टपकते टपकते 1 मिनट बाद दौड़ के चला गया। प्रोसीजर की फर्क है ना। आपने क्या सीखा है? कौन सी कॉलेज से सीखा बताइए? हेलो भाई साहब, कहाँ से सीखा आपने एक्यूपंक्चर?
हेलो।
हाँ,
सर
आपने कहाँ से सीखा?
नहीं, एक्यूपंक्चरिस्ट नहीं हूँ मैं सर, मैं फिजियोथेरेपिस्ट हूँ मैं।
हाँ, तो फिजियोथेरेपी में डिस्क प्रोलैप्स में कितना टाइम लगता है बताइए?
सर एटलीस्ट 1.5 month पूरा ये में सिम्टम्स
मेरे
वगैरह जाने देने।
वीडियो जाइए और देखिए फेसबुक पर।
जी,
1
you have
minute,
treated
2
sir
minutes,
even in 1 minute 2 minute, yes.
below 1 minute।
Yeah.
कैसे हुआ बताइए?
But my question is that sir, that just we treated by this needling.
VFTBN means the nerves are stimulated. When
Yeah.
the area arterial circulation has improved,
Yeah.
annulus fibrosis is created.
But there is
But the
root cause.
extruded disc, see, what is the problem? The nerve roots are compressed, right? In the
Yes.
neural foramina.
Yeah.
But are they only the neural foramina is creating the problem, or the arterial circulation and other things are also creating the problem?
Yeah, arterial circulation is also creating problems.
Right? Paraspinal
Yeah.
muscles are also creating problem.
Yes, yes.
See, the problem is not with this problem is with the acute spasm created because of this nerve compression. Why after 2 months? You see 99% of the people have a slip disc, right? 99%. Go to MRI and see. How many are taken injection? How many are on medication? Because body has a self-healing capacity called annulus fibrosis.
Recently, I have seen one patient, sir.
I'll tell you how many years of practice I have done. Can you guess? Since when I am practicing PIVD? Just guess out.
So at least
So 30 years.
yes,
30 years.
उनको बोलने दो ना, आप तो बोलो।
अच्छा
20-25 ईयर्स है।
आपकी उम्र कितनी हो गई?
मैं 45 का हूँ सर अभी।
अब जब
45 years.
14-15 साल के थे, जब आपने मैट्रिक पास की थी, तब से प्रैक्टिस कर रहा हूँ।
ओके
कितने साल हो गए? 35 साल हो गए ना
जी।
जिन पेशेंट को 22 साल पहले ट्रीट किया था, आज भी वो पेशेंट विदाउट डेफिसिट आराम से जी रहे एक्सट्रूडेड डिस्क के साथ।
जी
क्या हुआ? We are worried not about the disc or all. We are worried about the deficit. 3 things should not happen: neural deficit, sensory deficit, paresthesia, and neuropathy with caudal econa. ये 4 चीज नहीं होना चाहिए। लुम्बर स्पाइन में, सर्वाइकल स्पाइन में माइलोपैथी, माइलोमेल्चिया नहीं होना चाहिए। बस 2 ही तो बातें हैं। इन 2 बातों को ठीक करना सीख तो समझ लो, 80% प्रॉब्लम सॉल्व हो गया। You're worried about sleep disk, I'm worried about deficit. और क्या, आप मुझे एक बात बताओ, सर्जरी करने से कितना प्रॉब्लम सॉल्व हुआ है? बताओ, कितना का पेन सॉल्व हो गया? कितनी
नहीं सर,
डेफिसिट सॉल्व हो गई?
आफ्टर सम टाइम अगेन रिअकर्स।
Then what to do? Surgery is right.
Yeah.
Then तब क्या करेंगे आप बताइए? सॉल्यूशन क्या है? फिजियोथेरेपिस्ट के पास जाओ, वो टेंस मशीन लगाए, आधे घंटा ठीक हो गया, फिर दर्द आ गया, फिर ये करो, फिर ये करो। अरे प्रॉब्लम को समझ के उसको सॉल्व करने की कोशिश करना ही एक फिजिशियन का काम है। सबसे बड़ा फायदा मुझे यही हुआ, मेरे माँ मरने के बाद मैंने संन्यास जो लिया, नाउ आई डेडिकेट 22 आवर्स। अब तो मैं न्यूरो सर्जिकल माइक्रोस्कोप ले रहा हूँ, वही कि उस डिस्क को पूरे अच्छे से स्टडी कर सकता हूँ। डिस्क जो काट के निकाला है उसको न्यूरो सर्जिकल माइक्रोस्कोप में स्टडी कर सकता हूँ। पूरे ब्रेन को काट के स्टडी कर सकता हूँ। इसलिए मैंने 3 ओटी टेबल खरीदी है, एक रिसर्च टेबल, 2 ओटी प्रोसीजर के लिए। मैं ओटी तो करता नहीं, बट देन व्हेन आई नीड सीआम, व्हेन आई नीड अल्ट्रासाउंड गाइडेड प्रोसीजर्स, दे शुड बी डन इन एसेप्टिक एनवायरनमेंट। 90 केस ठीक हो गए, एक खराब हो गया, सारा झमेला खड़ा हो गया। एसेप्टिक हुआ, सब कुछ हुआ, कंसेंट फॉर्म हुआ, सब कुछ हुआ, कोई झमेला ही नहीं है। एक्सट्रूडेड डिस्क में पे इंक्रीज द पेन नेक्स्ट डे आल्सो। पेशेंट तो आगे मेरे को कुछ नहीं बोल सकता कि ऑलरेडी इट इज मेंशन इन द कंसेंट फॉर्म। मैंने लाखों पेशेंट ठीक किए, इससे मैं बोल पा रहा हूँ। आप मुझे आज से जानते, आप कितने साल से जानते हैं मुझे बताइए?
सर मैं आपको अभी जानना शुरू किया हूँ सर। अभी
जाके मैं फेसबुक पर देख लीजिए, 2016 से वीडियोस है।
1-2 महीने से जानता हूँ मैं आपको अभी।
2016 से वीडियो है, उससे पहले वाला फेसबुक डिलीट हो गया, उसमें 7 लाख वीडियो आ गए।
ओहो।
5 लाख वीडियो अपलोड हो गए, इसलिए अब इस बार हम लोग बहुत धीरे धीरे वीडियोस अपलोड कर रहे हैं। फिर भी दिन के 3-4, 2-3-4 कर ही देते हैं। 5 लाख वीडियो होते डिलीट हो जाता आपका फेसबुक। और हमारे पास स्टाफ की कमी है, इतना पेशेंट हो जाता है। बेचारे नर्स लोग रात को 2 बजे सोती है, मैं 3 बजे सोता हूँ सुबह। डे नाइट ड्यूटी करनी पड़ती है।
सर क्या हैदराबाद में आपसे मिलने के लिए आ जाओ?
आ जाओ, किसी ने मना किया? आओ, रहो, सीखो, करो। मैंने किसी को मना किया है? खाना फ्री है, अगर हमारी जगह, हमारे पास स्पेस है तो रहो, नहीं है तो बगल में पीजी हाउस लेके ले लो। कितना लेता पीजी हाउस रहने का? 7-8 हजार रुपया। 10 हजार में रहो 1 महीने शेड एकोमोडेशन में, बस हो गया था।
1-2 महीने में तो थोड़ा बेटर अंडरस्टैंडिंग आ जाएगी सर अबाउट एक्यूपंक्चर।
एक्यूपंक्चर का नाम मत ले मेरा बाप।
सॉरी सर।
एक्यूपंक्चर का नाम लोगे लीगल में फंसोगे। इतना कानून लगाएंगे ये लोग, इतना कानून लगाएंगे कि तुम्हारा 4 पुष्प भी प्रैक्टिस नहीं कर पाएंगे। जगह जगह तो काउंसिल बना रखी है, जगह जगह, और जो मन में आता वो लिख देते, जो मन में आता वो कर देते हैं। एग्जाम ले लिए, एक छुट्टी थी, उसको काउंसिल बना दिया, ये कर दिया। बाद में कोर्ट में लिटिगेशन होगा, सारा का सारा मैटर कैंसिल हो जाएगा। जितने रजिस्ट्रेशन हुए सब रद्द हो जाएंगे, फिर सुप्रीम कोर्ट में अपील होगी, तब तक क्या करोगे आप? सेम प्रोसीजर अपनाओ, ड्राई नीडल।
ओके,
ड्राई नीडल के ऊपर कोई लिटिगेशन नहीं हो सकता क्योंकि इसका कोई डेफिनेशन ही नहीं है।
गुड गुड।
Neither homeopathy defines dry needle, na acupuncture defines dry needle, neither anyone defines dry needle. आप कहाँ लगाओ ये आपकी मर्जी है। लीगली बस आपके पास एक लाइसेंस होना चाहिए कि यू आर ए फिजियोथेरेपिस्ट, यू नो एनाटॉमी फिजियोलॉजी, ड्राई नीडल इज वैलिड फॉर फिजियोथेरेपिस्ट, यूज ड्राई नीडल। मैं हमेशा ड्राई नीडल लिखता हूँ। एनेस्थेसिस्ट बोलता मैं एक्यूपंक्चर करता हूँ तो लिख ले तू तेरे आगे एक्यूपंक्चरिस्ट। मैं तेरे झमेले में क्यों जाऊं? मैं तो वही लिखता हूँ, ड्राई नीडल, वो सियाम गाइडेड प्रोसीजर इन ड्राई नीडल, क्योंकि नीडल का मतलब होता है बहुत सारी तरह की नीडल्स आती है। इवन मैं स्पाइनल नीडल को भी ड्राई नीडल बोलता हूँ। जो आप स्पाइनल नीडल यूज करते हैं ना एनेस्थेसिया में, वो ड्राई है तो ड्राई नीडल हो गई।
Very nice, sir.
तरीके से काम करो कि कोई कहीं झमेले में नहीं फंस जाओ। बस मुझे और किसी बात का डर नहीं है। आजकल क्या है कि पेशेंट्स आर वेरी वो स्क्राउटी मतलब समझे ना, डॉक्टर्स आर ऑलवेज सॉफ्ट टारगेट। आप लोगों पर तो केस ही नहीं हुए, एमबीबीएस एमडी पर तो रोज मार धुलाई होती है आसाम में। आई हैव कम फ्रॉम आसाम, दे डोंट इवन अलाउ पुलिस टू एंटर, दे किल द डॉक्टर। मैंने 1000 एफआईआर फाइल की आसाम में। कितनी? 1000 एफआईआर against the miscreants. So I know, first legally be strong. अपने कागज को इतने ठीक कर लो कि कल को कोई आंगली नहीं उठाए। एक्यूपंक्चर ऐसा वर्ड यूज करने का मतलब है आपको 5 साल की ट्रेनिंग लेनी होगी आगे जाके। ये WHO से सब रद्द हो जाएगा। लास्ट में इंडोनेशिया में हुआ ना, इन इंडोनेशिया यू हैव टू टेक 3 year degree, 4 year degree. Same thing was in Indonesia. Earlier they used to attend 5 days course and they became acupuncturist. Now the council has passed a law that they have to take a valid 3 to 4 year degree. तो वो आज हम क्यों नहीं चालू कर ले अपना काम? रात को 1 घंटा मेरी बकवास सुनने में आपको क्या फर्क पड़ता? टीवी मत देखो, मेरे को देख लो, खत्म हो गया बात। ये भी एक एंटरटेनमेंट सो ही है। मैं कौन सा काम एंटरटेनमेंट लगता होता? सोता हुआ, आता जागता हुआ। Question is very simple. What do you want? A valid credential or invalid credentials? Your documents and your knowledge, both should be perfect. ना अगर आपकी नॉलेज पर कोई हाथ उठा सके, ना आपकी डिग्री पर कोई हाथ उठा सके, ना जिसने आपकी डिग्री साइन की हो उस पर कोई हाथ उठा सके। आज इतने सारे डॉक्टर्स मेरे साथ काम करते हैं, किसी की हिम्मत नहीं है मेरे साथ मेरे पर हाथ उठाने की। इधर हम लोग दोस्तों की तरह काम करते हैं। मोहन सिंह is one of the most respected cardiac anesthesiologist from HOD from Manipal Hospital. It is a top 2 medical college in India. When he was HOD, it was number 1 anesthesiology. When it was better than AIMS, right? वहां के HOD थे। आज हम दोनों काम कर रहे हैं एक साथ। क्या हो गया? हम बाप बेटे की तरह काम कर रहे हैं। उनकी कमी मैं दूर करता हूँ, वो मेरी कमी दूर करते हैं। पेशेंट रिकवर होना इतना आसान नहीं है। इसलिए पहले तरीके, इसलिए मैंने बोला इंटरेक्टिव सेशन होना बहुत जरूरी है। क्लास चालू करना, क्लास पढ़ाना, हर यूनिवर्सिटी में यही होता है। 15 दिन इंटरेक्शन होता है। You are going to study for 1 year or 6 months. What are you going to do? You are going to see, we have completed 2 years. Our permanent student, Roni, Amadi, all are there. But those who don't have vision, They left. They have domestic problems, time zone problems. But even Ahmadi had a time zone problem. He continued. Tomorrow I will be able to give Ahmadi a valid certificate internationally. At least he may not practice Singapore. He may practice in India. He may practice in other countries legally.
सर alternate medicines को क्या कर सकते हैं?
Alternate क्या होता है बताओ तो?
कुछ पढ़ाते भी सब
क्या
कुछ
होता है
पढ़ाते
अल्टरनेटिव मेडिसिन मतलब क्या होता है बताओ?
हैं सब थोड़ा थोड़ा पढ़ाते हैं सर आयुर्वेद
ये
योग
वैलिड है? कौन सी यूनिवर्सिटी ने वैलिड किया है?
इंडिया में तो नहीं है सर
नहीं है तो ये अनरिकॉग्नाइज्ड डिग्री है, इसको लेके जेल जाना है। अगर आप ये प्रीफिक्स भी कर लो अपने नाम के साथ,
जी
इंडिया अल्टरनेटिव मेडिसिन, राइट, सीधा बड़े घर को जाओगे। ऐसा कोई काम मत करो जिससे आपको तकलीफ हो, वही करो जो लीगली वैलिड हो। नहीं तो एक आदमी को BNY पढ़ने के लिए 4.5 क्यों लगे? वो रामदेव जी के पास जाए, 1 साल योगा सीखे और सबको योगा सिखा दे। हाँ, MBBS को क्यों पढ़ना पड़े? वो भी आगे RMP डिग्री लेता था। Because see, these credentials are important not only for your knowledge, because you are dealing with life, and life can have a death. For example, recently a patient came. Before entering the ambulance, I saw his death. So when I entered the ambulance to see the patient before shifting my room, I declared him death. He is death. मेरे रूम के अंदर आके वो डेथ से डिक्लेयर होता है, मेरे लिए महाभारत हो जाती है। कागज क्लियर करते 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 कागज है। और कल को कोई लीगल लिटिगेशन आ जाता, वो नॉलेज थी इसलिए एम्बुलेंस में चेक कर लिया, जिंदा है ना मर गया आपका। हाँ, अब उसके बाद मरने के बाद हम अपने सेंटर में लाए, 3 घंटा वी ट्राइड 3 hours on that patient. We get atropine, dopamine, whatever was available. We gave CPR. Patient did not revive. He died. Okay, it's okay. We tried our level best. When you work, you should have everything. You know, in our institute, we take up ECG every morning. You know why? Free of cost. बताओ क्यों? Tell me why. Every
So
morning.
evidence,
Yes, by chance in afternoon.
evidence, yes.
Yes, by chance in afternoon or evening, he has a cardiac arrest. No one can blame us because cardiac arrest can come any day. This is his morning ECG. We have checked, nothing was found. Patient did not complain any uncomfortability because this is not a hospital, it's a rehab center, which is converting into a hospital in a future time. How many days I came back to Hyderabad? Tell me. 6 months. I started my practice in 6 months. Can you imagine? With 2,000 rupees, I'm establishing MRI, CT, EMG, EEG.
Sir, you are building an asset for the upcoming students.
You are right. I'm building not only asset, my documentation, my books. Tomorrow when I die, and after 10 years illegal litigation comes, these books will be quoted in the statements of the Supreme Court because they have evidence.
Yeah, yes, yes.
That by putting this needle, no nerves can be damaged because the size of the needle is this and the depth of the nerve is this.
Yes,
No
sir.
electrical impulse can damage the nerve.
Right.
कौन जाने कल जाके कौन लीगल लिटिगेशन कर दे. Documentation should be very good. This is what I learned in America. That is why I said I broke all my fixed deposit, whatever money I had. I sold all my gold jewelry. So I took sannyas. Why I took sannyas? So that I can sell whatever I have. And I purchased this equipment. For whom? For myself? No. Why did I give it to free to the patient? So that patient does not object. At least documents will be created.
Right, sir.
You have no treatment for neuropathy in allopathy, correct? Pregabalin, gabapentin. But tomorrow, in 50 patients, I prove patient has recovered, and after 6 months, this is a document. 1 साल में एक document create हो गया. For 100 years, this document will be valid. We are not supposed to work for 1 year. We are supposed to work for 150 years. हम जो काम करके गए उस वो 150 साल की न्यू रख के जाना है. ये 2 नीडल घुसा के ये दर्द कम कर देने से प्रैक्टिस नहीं होता है. For example, right? You do not know what is myelopathy. What will happen? Patient became quadriplegic just after treatment of your patient. What will happen? You will have a legal litigation because you did not do the diagnosis. कम से कम अगर प्रॉपर डिग्री है तो सरकार से बात करके आपको लीगल मेडिकल डायग्नोसिस करवाने का परमिशन तो होना चाहिए. And government will give you this permission. Because it is an independent medical science. You have a right to write diagnosis. Without diagnosis, how can you sign? Ayush has given you the sector of what in India? The independent medical science. Now you must know what is myelopathy, what is myelomyalgia, what is compressive myelopathy, what is non-compressive myelopathy. What is peripheral neuropathy, what is non-peripheral neuropathy, what is mixed neuropathy, what is demyelinating neuropathy. Demyelinating neuropathy अगर आप देखो तो छूना भी मत. कोई भी एनसीवी स्टडी में देखो पाउंड जल रहे हैं, बर्निंग सेंसेशन, पेरिस्थेसिया इज देयर, go immediately for NCV test, EMG NCV, and say there is demyelination.
Your mic is mute, sir.
So your mic is mute.
You only muted. Did I mute my mic? No. You got bored with my lecture, so you muted my mic.
No, sir.
I'm not teaching something interesting. I'm teaching some illegal.
Sir, we are getting energy rather. We are encouraged, sir.
See, acupuncture when can maintain an open heart surgery. There is a document. There is a video. Why do I put all these videos in Facebook and social media? It is a evidence. So many people have seen. Why I have said in groups? So many physiotherapists have seen. The patient is saying, I'm okay. He has stopped coming. That means what? He is okay. पार्किंसन का टर्मिनल स्टेज में सिंडोपा इज नॉट वर्किंग, वो पेशेंट को लेके रिवाइव कर रहे हैं. और क्या चाहिए आपको? मरने वाला पेशेंट है साहब. 10 दिन ट्रीटमेंट नहीं करो तो ये तो पेशेंट तो टपक नहीं जाएंगे. इफ आई डोंट ट्रीट दिस पेशेंट फॉर 10 days ऑल्सो, मरना बिल्कुल मर ही जाएंगे. ये हालत है. उन पेशेंटों को लेके बैठा हूँ. दैट इज व्हाई आई कैन नॉट मूव आउट फ्रॉम हैदराबाद. And still we are struggling day and night to bring life to these people. Ask question. Only 10 minutes are left. 4 minutes are left.
हेलो सर, क्या जीबीएफ ड्राई नीडलिंग से ट्रीट किया जा सकता है?
200%. बट कौन सा स्टेज में क्या है वो सब देखना होगा.
Sir, one of my patients is just bedridden for 2 years. 2 years.
See, the question is how, what is the status, whether the treatment is responded by this treatment or not, that also has to be seen. It has been clearly published by international people, pages, that acupuncture dry needling stimulation does not work on 10% of the population genetically.
Okay.
तो वो किस कैटेगरी ऑफ पेशेंट में आता है पहले तो वो देखो, उसके बाद उसके नर्व में उतनी ताकत है क्या उसको बचाने लायक, क्या वो गया है. वरना ट्रांसफर मलाइटिस 12 साल पुराना ट्रांसफर मलाइटिस रिकवर हुआ है शरद बोल के.
मैं उनको आपके बारे में बताया हूँ सर, उनको रेकमेंड किया हूँ मैं आपके पास इधर आने के लिए, दिखाने के लिए.
मेरे पास तो बाबू 2 महीने के अगर उसके पास नहीं हो तो मत ही भेजना, मेरे से कुछ नहीं होता 15 दिन में 10 स्लिप डिस्क का केस हो 10 दिन में कोशिश कर सकते हैं, बल्कि 15 दिन 10 दिन में ना. एलोपैथी कुछ कर सकता है ना, होम्योपैथी कुछ कर सकता है ना, आयुर्वेद कर सकता है ना, भगवान कर सकता है. भगवान तो कुछ ही नहीं करता, वो मंदिर में चुपचाप बैठा है मुंह बंद करके.
सर वो रुक सकते हैं वहाँ 1-2 महीने तो रुक ही सकते हैं वहाँ.
वो रुक सकते नहीं, 2 महीने रुक सकते. अगर उसको उठाना है तो पूरी कोशिश करनी पड़ेगी, वरना पड़ा रहो बेड में, क्या मतलब है हमें. बेड सोर होंगे, इन्फेक्शन होगा, लंग्स डेफिशिएंट होगी, एंड ही विल डाई.
He is just 51 years old.
Let it be 51 or 61. They have taken the case to that level that the patient will die after some time. Diaphragm failure and the patient will die. Bedridden, diaphragm failure, patient die. That is why whenever this type of patient comes, I immediately put the cardiac meter. 5 parameters. I purchase 20 parameters. Why? Any type of such patient come, immediately I put the 5 parameters. सांसें चल रही है, हार्ट बीट चल रही है, सब कुछ ठीक है, हाँ ठीक है, ठीक है. बस क्यों खरीद रहे EMG ECG? पहले ही दिखा दो भाई, आपकी डीमाइलिनेटिंग न्यूरोपैथी, आपका नर्व खराब हो चुका है. अगर और कुछ करना तो कर लो, नहीं तो मैं जो कर सकता कर दूंगा. तो लर्न.
हेलो सर.
मेरा बोलने का मतलब है मॉडर्न डायग्नोसिस पढ़े बिना आगे नहीं पढ़ सकते. आपको खुद को स्टडी करना होगा. NCV, EEG, ECG. मुझे ECG पढ़ना आता था, तुरंत देख लिया, अरे कार्डियोलॉजिस्ट ने तो इसको मिस किया है, इसको तो 80% ब्लॉक होना चाहिए. इमीडिएटली उसने बोला हम लोग 2T डॉपलर करेंगे. मतलब बाहर में जाओ, 2T प्ले. आई सेड गो टू योर हेल्थ, 2T डॉपलर इन के राजेश केस, put him in the angiography. Angiography has 80% block. Rajesh was saying, I'll go home, I'll do this, I'll do that. I just shut up your mouth. Go for balloonoplasty and put 2 stunts and go home. Within 1 week he was recovered. Now he has joined clinic. You see, he's doing excellent work in his clinic. No chances of heart attack. By chance at that air pressure, if you would have gone with cardiac block, would have died. You have lost good people. तो सामने वाला फिजिशियन सही है, वो आप कैसे बोल सकते हैं? हाउ कैन बी ए न्यूरोलॉजिस्ट करेक्ट? द डायग्नोसिस मेंट बाय ए न्यूरोलॉजिस्ट कैन आल्सो बी ए मिसडायग्नोसिस or something is missing in the diagnosis. Your clinical diagnosis, until you are satisfied with your own diagnosis, we should not believe on others. और नीचे मेरे को बोले ये कागज पढ़ो. मैं बोला मैं नहीं पढ़ता, मुझे कोई PhD करनी है आपके इतने कागज पढ़ के IVF के. मुझे मालूम है क्या है, इतने साल बच्चे पैदा किए हैं, पर अब मैंने छोड़ दिया है. आई डोंट वांट टू डू. उम्र हो गई, बस बुढ़ापा आ गया, मम्मी भी मर गई, अनाथ हो गया, अब नहीं चाहिए. पेन पैरालिसिस, माइलोपैथी, मोलोपैथी, बोन एंड स्पाइन इज ओके, ब्रेन ऑर्थो एंड स्पाइन ठीक है, बाकी autoimmune disease ठीक है, CP child ठीक है. because you know why I'm treating CP child? because we have seen vast improvement in them. आओ सीखो करो, जो नहीं समझ में आता वो हमें भेजो, हम कोशिश करते हैं, हमें से नहीं होगा तो समझ लो नहीं होगा, बिकॉज वी हैव ए टीम ऑफ डॉक्टर्स. एक बार देखते हैं, कोशिश करते हैं. एंड आई ऑलवेज से दिस इज आवर लास्ट ट्राई. इसके बाद यहाँ नहीं हुआ तो कहीं नहीं होता. दिन में हम 4 बार एक्यूपंक्चर करते हैं. मैं एक बार ब्रेन स्टिमुलेशन करता हूँ, 3 बार फिजियोथेरेपी होती है, 2 बार डॉक्टर विजिट होती है, मल्टीपल आईवी ड्रिप चलता है, तब जाके कहीं पेशेंट कहीं खड़ा होता है साहब. और देते कितने हैं? 2-2.5 रुपए. इतने तो उसकी दवाई के खर्चे हैं. How much they pay us? 2,500 or 3,000. Question is not money. Question is documentation. I'm only working for documentation now. This is the last part of my life. I can die any moment. This also not correct these days. So before that, I must create a sufficient document for you for coming 100 generations, that when you or your children choose acupuncture as a career, they should be confident enough that what allopathy, what cannot be done with all pathis, this patni can do.
Nice, very nice. Patni.
Day by day being very much confident about it.
Beautiful word, sir.
Homeopathy, Ayurvedopathy, electropathy, sapathy. When all pathis are failure, then this patni is finally successful.
You are always successful, sir.
So I call it acupuncture as this dry kneading procedure as Draupadi, patni of Pan Pandav. So, 1 minute. So what I mean to say, see today BEMS and all these are done, but are they recognized? If anything goes wrong, we'll be in jail. Why do they take out an ABS to recover paralysis? Because if something happens also, I will not, no legal litigation can happen on me. Why? I put it here. What will happen here? Please check MRI. Please do CT scan. You are shouting, so I put 1 needle here. This dry needle. Maximum to maximum, court can say me, don't do it again. Will I go to jail? No. But by evidence, we can say this has recovered patients. Now, this has to be proved by what? MRI, and then in Karat, we have functional MRI. So both it has to be proved by MRI and functional MRI. Once we approve functional MRI, then China, America, France, Italy, no one can compete with us, because we scanned this brain after every 3 days. Everyone is happy that they are getting a free MRI. That is why I am purchasing the equipment free of cost. I said FOC. No one is sponsoring me, but I know how to play. That is why I said, your small contribution, what you gave me in revision class, I purchased EMG, ECG.
Hello, sir.
EEG.
One question, sir.
1 minute. I purchased all these documents. Why? So that I can prove you neuropathy, which cannot be cured by any other system, can be created, recovered by this. These are the points. This is the system. We have recovered 50 patients. Now, this is a document. Now you can publish this paper. Whether you publish or not, it is what? Proven. And it can be internationally placed by any court of law. That such research was done in India. This is a document. This is a study, and this is what you get. Last question, please.
Sir,
Tell me, Babu.
my only question to you is that
Tell me. Only question to me. Only question to me is not there.
sir,
Ah,
some disturbance, sir.
okay. Disturbance clear. Now tell me the question.
Sir,
Ah,
sir, I just want to say you on evidence base, but I'm not able to say some disturbance.
it's okay. Record and put on the our WhatsApp group. What is the problem? WhatsApp group is there. We will see there. You put on Facebook, copy the link and place it there. We'll see it there. Take a consent of the patient. All my patient gives consent to me. Put us on Facebook. They are very happy to give me consent, you know. Out of 100, 99 patient gives consent. Ask me question. And those who
Sir,
do not believe in evidence, go and see in my Facebook. I have 250,000 videos. Facebook has given me notification. So I'm worried. So I upload only 2-3 videos a day. If by chance it becomes 5 lakh or 3 lakh or 4 lakh, they will close my Facebook account. My only asset is this one, mobile phone. I don't have a laptop also. Ask me a question.
sir, good evening, sir. This is Sangala from Warangal. How are you, sir?
Warangal ji, boliye.
Sir, please suggest me to treat salivation, sir, extra salivation, rule of CP child. Which area I should concentrate more on brain? Which area I should?
Your concentration in particular area of recovering a disease, of ischemic insult, will not finish it drooling. Brain has to what? Expand in its own way, called neuroplasticity. Read papers. You focus on small areas so nothing comes up. You must have a treatment plan. It is not like this duosun scalp. I don't practice duosun scalp. Motor line you place this line, you place this line. Neuroanatomically, it is totally wrong. Put me to the best neuroacupuncturist of the world. I'll prove it in 1 minute it is wrong. See, here is a Sylvian fissure, right?
Sir.
Sylvian fissure this is a temporal lobe, correct?
Yes. Yes, sir.
Then how did you insert subcutaneously the needle from here to here? And then you say 1/3 is the motor line, 1/3 is this, 1/3. You see the onculus? You see the motor cortex? Lower limb is this much. Toe is this much. Hands is this much. Which muscle of the limbs you want to recover? I'm giving you an example. Jyosun, according to me, is wrong. It may be right in his time. Today it is wrong. Because it cannot give muscle to muscle, nerve to nerve, area to area, part by part recovery. Why did I stop tongue acupuncture? Tongue acupuncture I stopped because it treats the symptom of pain only or some other disease. It does not recover a disease. Whereas the same dry needle, if practiced properly, recovers a disease. Why I have five disc prolapse. I suggest a patient, you want to go for surgery or you want to go for my treatment? Say your treatment. My treatment costs this much amount. Will you go for surgery? No, sir, we want your treatment. Even the orthopedic surgeon, if you hear his lecture, 80% of the people don't want to go for surgery and medicines. They are taking because they have no alternative option. If you create an option, they will go for your option. Why did I bring inbuilt physiotherapist, inbuilt acupuncturist in house? So that they can work totally 3 months. I know they will stay here for 3 months, 4 months. Again, they will run away. This is a tradition here. No one can work here more than 3 months, 4 months. Because they feel tired, because they are not their ambition and vision. Your vision should be of a specialist. To learn, to practice, and to be what? A specialist. But what did you become? Did you become specialist by whatever you do right now? Can you manage complicated cases? We manage all type of complicated cases. Any more questions? That is why I say paralysis recovery, total recovery is not possible, but a significant improvement can be seen before the half cup of your tea is recovered. I told the neurosurgeon, you take this tea and you drink sip by sip. Before your half cup is finished, you will changes in my patient. You will see recovery in my patient. You check now, and now you check. Orthopedic surgeon, I said, is the top 5 orthopedic surgeon who came to me from Mumbai. Top 5. He had done 3,000 knee and hip replacement. He said spasticity cannot be recovered. I said, if I recover you within 5 seconds, will you give me French kiss? He said, okay, I'll do. I will take from you. See, now check. Go on. Then, how subcutaneous needling will improve? That is a different question. But does it improve? This is the first question. Is it a hypothesis? Everything is first a hypothesis. Even today, Avogadro's hypothesis we study and we work on Avogadro's hypothesis. Even to some extent, Newton's law of motion is also an hypothesis. Everything is an hypothesis. How covalent bonds are created is also an hypothesis. But yes, to some extent, we are able to prove it with the help of latest equipments. Similarly, we have to prove all these things by documentation. I'll take 2-3 months to create all the equipments. Now I have only one equipment, what you call C-arm. And in this C-arm practice, I proved that the needle by live telecast, that this has gone to the near the nodes, it has stimulated, and the pain of the patient is instantly reduced in 20 seconds with the spine pain. It was lively performed. I'm the only physician who has no advertisement, nothing, not even a board of M.K. Sastri. Even in my building, you will not say a board of M.K. Sastri. Only one word is written. M.K. Sastri, no fees, no charges, no salary. Why? So that we get an opportunity to reduce the cost and recovered the patient. That's all. We have to prove we have recovered the patient. Not by clinical, but also by. That is why in every video you will say, I have seen, put 5 clinical tests. Of 5, 3 must be negative. In every video you will see, I have seen. I take physiotherapist and I ask him, what is his spasticity? He checks and says, sir, there is no spasticity. Are you qualified to say this? Yes, I am qualified to say this. Then it became evidence. If I say, I treat and I only say, yes, no spasticity. We all can say the child is walking. Now put this video in the court. How can court comment? How can court deny the statement of these patients? First is legal documentation. Second is evidence. दो चीज जब तक आपके पास नहीं हो, तब तक आप किसी चीज को साबित नहीं कर सकते. And that is why I am buying MRI also. I am buying all the machines of neurophysiology, neurology, neuromicroscope to prove that even vascular anastomosis is very important after TIA attack. Only to prove one subject, vascular, the importance of vascular anastomosis, I am investing 6 lakh rupees only on what? Microscopes. I don't have 2,000 rupees. I came with 2,000 rupees. But then you see, how much am I investing? I learned accounts now. Now I and my chartered accountant play very nicely. Tomorrow you see how much we improve. Because after 3rd day of brain stimulation, NIBS, he is able to walk. He has improved. What is the lesson of his brain from 1st day to 3rd day? Definitely some changes has happened. That has to be measured. From 3rd day to 7th day, what are the changes? That has to be measured. Then only it is evidence. Otherwise, all is stump. And the court asks evidence. This much, a truck of evidence should go to the court. So this is the evidence. 2 rooms should be full up with evidence. Then no one will come and shout. No one can say acupuncture is quackery. When 20 years back we practiced, people used to say acupuncture is quackery. Now come and tell me. Tell a word. Even a neurosurgeon come and says, sir, you are doing a great job. Without you, we are nothing. Because the first question people ask, when my patient will walk. That you only can answer, sir, not I. I can explain the patient, this is how I will remove the tumor. But I cannot explain the patient that tomorrow he can walk or not. That only you can explain. I say, sir, tomorrow, day after tomorrow, when the patient is stable, vitals are stable, he will walk. My confidence, 200% confidence. This is what I say. It means in 7 days your patient will walk. Do the surgery, sir. I'll damage these areas. You, sir, you damage whole brain. What I will do? This is how I speak. I know surgeon will not damage the whole brain. If some accident happens, we'll manage. What is there? We have to learn, we have to manage. Whole life is management. Your wife is also management, your husband is also management, your children is also management. Similarly, this case is also management. How you solve the problem of your wife? Wife solves the problem of the husband. Similarly, we must learn how to solve the problems of our clinical practice. Buying equipment will not help. Right? More questions? I think it happened on overtime. 10 o'clock. Amadi-san is beating me. He's throwing stones. Someone has thrown stones in the house of Amadi. Amadi, sorry, bhai, someone is pelting stones. So I close the class. Thank you.
Thank you, sir. Good night, sir.
Thank you and good night, sir.
Good night.
Good night.